All right, good morning, students. We're so happy you are here today on your Wellness Wednesday, the last week before spring break. We are so close, you guys. 2 days away, then we get a week off to recharge before we start the last push to our summer break. My name is Mrs. Smith. I am the Director of School Counseling here at Freeman, and we are very fortunate to be joined by Dr. Bitsko. Dr. Bitsko is a licensed clinical psychologist, and he is the founder of Summit Emotional Health, which is one of the counseling services here in the county that provides a lot of support to students and teenagers and adults alike. We're really fortunate to have him here. I think he is a great speaker, and he's really good at relating content in a way that makes it relevant for teenagers. So we are here to talk about some coping skills, defining what that means, slowing down in this COVID era that just has our lives turned upside down. So I'm going to throw it over to Dr. Bitsko. If you do have questions, students, I'm going to be emailing you a link to your HCPS email account where you can submit questions for Dr. Bitsko. And we will go through those after we have a brief presentation by Dr. Bitsko. Thanks for being here.
Thank you, Mrs. Smith. It's a little bit of pressure that you threw on me there, so I appreciate it. Thank you so much, and really looking forward to speaking with the Freeman family of Mavericks. What we want to do today is take 10 minutes in speaking with Mrs. Smith and with Mr. Marshall, with all the great offerings of Wellness Wednesday. We just wanted to kind of slow down and kind of figure out what is the best way to use all these skills. What's the best approach that each of you could have to really figure out which coping skill or which kind of technique might be best for you. So this is a chance to kind of slow down and almost use this as your own user's manual for all the different offerings that we have during Wellness Wednesday, whether it be mindfulness, gratitude, focusing on staying calm, all the goal board offerings that you guys are going to have. I wanted to slow down and speak to each of you as far as what might be the best fit for you. So the first way we look at this is, as high school students, you guys know, certainly you're smarter and more insightful than you were even 2, 4, 6 years ago. And we're not talking about just in math or in English. You guys now know yourselves, you know your strengths, you know your weaknesses, you know the way that you think about things and your kind of emotions and the way that you process those. So the best answer when it comes to, well, out of all these coping skills or all these options, which one should I pick? The best answer is going to be, that's your choice. And if you ever feel like someone is saying, oh, I think you ought to try this, oh, I think you ought to try that, and they don't explain why or what the benefit is, then none of us would really be too excited to try any of these, even though they might be very good skills. So we'll slow down and look at, in this user's manual, when we talk about some of these skills or the coping skills, the only way I know how to understand it is almost as if you have to climb a mountain. And if you have a challenge or if you have an opportunity and if you have to climb the mountain, what do you need? Whether it's what kind of equipment do you need? What kind of skills do you need? What kind of knowledge do you need? And then when you personally know kind of what you need, then you can set it up so that you have all those supplies. So that's the only way that I even get to understand what these coping strategies are, because people talk about it and they throw these words around. But unless we slow down and say, what are these and how can I use them? Then it might not be as helpful as they could be. So here's 2 different approaches we can do. Number one, when you're looking at the menu of options for the Wellness Wednesdays, I think it's really important that we focus on what your strengths are. What do you already feel confident in? What do you already feel like you have at your disposal? Those are always the things that we should go to first. Whether it's a time when you're really excited about an opportunity, or you're very fearful, or you're very sad, or you're grieving a very traumatic loss. All these things come up in your lives and in our lives within our whole community and county, right? But number one is focusing on your strengths. What kind of people do I have around me? What do I think I can do fairly easy, fairly quickly? And those are the things that you want to focus on first. The next piece, and this is what I deal with a lot when I talk to folks, when I talk to high school students or their families, here's the best way to try to figure out which coping skill could really fit best for me right now, okay? So here's the 3 ways of looking at it. Whenever we go through hard times, we're sad, we're anxious, we're scared, there's 3 ways that we process that. Number 1 are our thoughts. Number 2 is what is our body's response maybe to those thoughts. And the third one is what is our emotional response, okay? So you got the thoughts, you got your body's response, and then your emotional response. So if you think about which ones come easiest to you, which ones you do best versus which ones are your kind of weak point, and which ones kind of trip you up and make you stumble a little bit if you're overthinking things, or if your body's getting really, really, really nervous and you don't know how to even think about that or how to even address it to calm your body down, right? That could be something really good for you. Or if you're okay with the thoughts, your body, you don't even think your body's even responding, but you get really emotional and you got to figure out what to do with that. So those are some of the things that we would talk about there. So I think as you guys think about that, and on an individual basis, if you're thinking about what are the best ways that you'd be able to do it, that's what I want our next 15 or 20 minutes of conversation to be like, as far as, well, if I have some of these thoughts that are racing and I really don't know what to do with them, or they're pretty negative, and I don't really pay attention to some of the positive or some of the optimistic thoughts, what do I do about that? Because once you know what those are, and once you know kind of what your strengths are and what your weaknesses are, then we can say, oh, maybe it makes sense to try some deep breathing, because that might help calm your body down, which might slow your thoughts, which might help you to know what to do with your emotional response, even as difficult as it is. So that's my way of kind of looking at that, and the way to kind of figure that out. So that's our quick little summary of the user's manual to say what is the individual way that you guys can really look at what is most important for you. So with that, I don't know, Mrs. Smith, there's a way that we can kind of open that up for questions and make it pretty specific to the folks.
Yeah, definitely. So we had a question: how do I know where I'm experiencing this distress? You mentioned physically, emotionally, or even in our thoughts. What if we're confused about where we even experience those? Where would we begin?
That's right. That's a great question. And a lot of times we don't even slow down enough to try to pay attention to it. So the first step is almost just trying to slow down and even try to see what our body's experiencing. That can be the first one. And if you're like, no, I can't even focus on my body because my mind is racing. If I ask anybody, what do you think out of the three? Is it your thoughts? Is it your body's response? Or is it more of the emotional reaction? Folks will usually know. They'll tell you right off, because I can ask them, well, in what order do you think that they happen? A very common way is, I know, I realized that I had the thought, which means that I got butterflies in my stomach, which means that my neck is stiff, which means that everything else, or sometimes they'll just say, I just realized that I'm scared and I'm kind of shaking. So it goes emotional, body, thoughts. So the first step would be to try to slow it down, pay attention to yourself. And even if you didn't feel like you knew which one of the three was really kind of driving that train, if you slowed down for 30 seconds, I think you would get some good information.
And just as a quick reminder to students, I just emailed all of you to your HCPS email account the link where you can submit questions for Dr. Bitsko. They're rolling in, so please feel free to continue submitting those questions. So Dr. Bitsko, we talked a little bit about that physical reaction, and we're getting a good number of questions about panic attacks. How do I know if I'm having a panic attack? What should I do? And what do you do if you're having a panic attack in a large crowd or a large group of people?
Well, that's a big one, but that is something which actually, I'm not going to say it's common, but if you think about what we've all been through over the last year, and just a little bit over 1 year ago, everyone had to not go to school, had to go to their house, kind of shelter in place, and now 1 year later, we're all trying to open up, get back to schools, get back to safe social kind of interactions. It's going to be very natural that our body and our thoughts are going to be, just a little bit anxious, right? Because we haven't done it for a while. We're trying to stay safe. So to the point of panic attacks, or if our symptoms are really kind of screaming at us, the first thing I would say is it is really important. So in the example of the body's response, that's where, what a panic attack is, it's not just one or two physical symptoms, because we all have them at any time. When I was getting ready for this talk, my hands were sweating and I was trying to do some deep breathing because I'm trying to figure out how I can do this best. But that's normal because I was nervous for this presentation. If you have a panic attack, it's when your really heart starts racing, maybe your chest feels tight, and you really just need to find, your first response is, how do I get out of here? Because if we're anxious, our first thought is to avoid, just to leave. It's that whole fight or flight, which is nothing wrong with paying attention to that. The problem is if that's all we do, if it's a continuous day in and day out fight or flight, and I just leave and I just avoid that, that turns into something which is not fun. So more to the question of when I have these physical symptoms, what can I do? So here's some examples for that. That's an example where some deep breathing, even if you're in the crowd or if you're in the if you're in the classroom, maybe you need to step out, right? Maybe not. If you have some practice, you can step out, try to go somewhere just to do some deep breathing, right? One of the examples I'll give, and if I would have told this to someone but not explained this great question, you would say, well, why the heck would I do that? So one example is called 4-box breathing. And if you Google 4-box breathing, it's actually something that Navy SEALs and Marines use. And they use it not only right in the middle of combat, but they especially use it leading up to that big event that they know that they have to do. So as they're getting ready to try to calm their body so they have as much energy and focus for this big event that they need, whether it's your test, whether it's a competition, whether it is a music event that you have going on, 4-box breathing is one example of just deep breathing, which can really help reset you. Because the really cool thing about deep breathing is it automatically, it's kind of like a trick back to your brain. Because if you slow down and you just try to breathe in deeply, then your brain starts going, well, I must be safe. Because when I was scared and experiencing that panic attack, our breathing gets fast and shallow. But when you try to slow it down and just go like, try to breathe in for 3 seconds, try to breathe out for 6 seconds, then all of a sudden, if you do that for a minute, then your brain and then your body's like, okay, I must be safe, I must be calm, and I can stay here. And if I can stay in the place, which is really scary for me, then that builds confidence. It helps you know that these things are going to happen. And when it happens, it doesn't have to tell me what to do. It doesn't have to make me leave every single time. One other example I would say, and if it comes up with a physical piece, one great skill that can either be added to the Wellness Wednesdays or folks can Google and get on Spotify or iTunes is progressive muscle relaxation. That is a great one that you can do because it just reminds your body what's the difference between tension and relaxation. And that's one of those things that you can do and you can practice for 5 or 10 minutes.
Great. Thank you, Dr. Bitsko. How would I even know if I'm not really mentally or emotionally healthy? How do I know when it's time to really get some extra help with some of these coping skills?
It's a great question. So I'm the kind of therapist, I'm the kind of psychologist who really, I'm not quick to diagnose. I'm not quick to say, oh, you must have anxiety. That's now part of who you are, or you're very depressed. And that's, I really believe that we all have the abilities to really deal with our day-to-day stressors, even some really intense stuff, which is happening within our community here in Henrico and Godwin, as tragic as these things are, with the supports that we have, with the ability to kind of, be able to talk to folks. Hopefully we can get through this day in and day out. So my first response to that is if you don't know, and if you're asking yourself, hey, am I okay? Then that means you're probably okay, but you need to just figure out what kind of supports do I need. The main question that I ask folks, as far as how severe are your worries or your sadness and how long have they been there, how strong are they, is if things start to get in the way of your day-to-day activities. So you can go online, which I don't recommend, and you can say, well, what are the symptoms of depression or anxiety? And you can be like, I checked 8 out of the 10 symptoms for depression or anxiety. Okay, there's maybe nothing wrong with doing that, because then if you talk to your parent or your friend or someone who you trust, you can say, I am a little bit worried about it. But just because you have 8 of the 10 symptoms, it doesn't necessarily mean I am depressed or I'm anxious. There's a second question to ask, which is, how much are these symptoms getting in the way, or how much are they getting in the way of my daily functioning? Are they making it harder for me to sleep? Am I not getting out of bed? Am I not going to school? Am I going to school late? Does it mean that I'm not turning in my work? Does it mean I'm not going to practice, that I'm not doing some of the hobbies or staying involved socially that I want to? If you start to say yes to those things, that's when it's like, no, this has been happening too long and too strong, and I should probably talk to someone about that.
So we actually had a question that I think you just answered, but I want to hit on it again. So what should we do if the problem that keeps bothering us constantly stresses us out every day to the point of mental breakdowns? I think that's probably a sign that we do need to get some extra help, but I don't know if you have any additional thoughts on that.
Well, one of the things, because it's important, if you think about it, what is someone like me? What's a therapist or a psychologist that you can speak to? Hopefully there's someone who you can be really open and honest with. You can tell them some of the fears that you might be slow to speak to other people with. But at the end of the day, I end up being basically a third trusted adult. And that's one of the mantras that I say immediately. And even if you never go see a therapist, I would say to parents, or I would say to high school students, make sure that you're trying to figure out and you're cultivating who is that second, third, or fourth trusted adult. Hopefully you guys have great friends and share that with your friends. But as you know, there's a time when your friends aren't supposed to know how to handle some of these things, when you really can't go to school, you're not getting your work done, you're not going to practice. So that third trusted adult, whether it's an aunt, uncle, if it's a parent of a friend, and if you have that support, that can be very vital, just to let you know, even in these really difficult times, I'll be able to handle it. It's tough, but I have the support around me. And if that means sometimes I need to talk to someone like a therapist or a psychologist, that's fine too. But the first thing I do in working with a family or with a high school student is, while you're working with me, let's get your support system set back up so you have those folks out there. I don't know if that answers the question or not.
I think it does. And I want to have a quick plug for school counseling. Your school counselors are also available as that supportive person and that trusted, third party in your life. We are here for more than just scheduling, even though it doesn't feel like it right now as we're prepping for next year. But your school counselors are also able to help with that.
Very true. Very true.
All right. There is a really good question about how do we not allow the current worry that we're experiencing about maybe something that's in the future paralyze us right now. So I'm worrying a lot about something that might be happening 6 months from now, but it's really affecting me right now and I feel paralyzed in the present.
Yeah, that is a great question. One of the things I would say is, if you realize you're doing it, that's already most of the victory, right? And if you talk to someone who's experiencing that kind of worry or anxiety, what most of us will say is, well, just don't worry about it. Stop thinking like that. And that's not helpful when people are worried or anxious and they know there's something 6 months down the road. One of the best first steps is to be able to say, all right, how can you kind of calm your mind, calm your body? Because if you're really stressed, anxious, and you're feeling paralyzed, we're not going to think that clearly, right? So if I'm trying to say, well, Johnny, tell me what you're thinking about, but they're still so scared, worried, worked up, I'm not going to have the best conversation. The first step is, all right, let's just try to calm down a little bit. Tell me about your worry. Let's bring it back in time to let me know, well, then if that's 6 months away, what do you worry about in 3 months or 1 month, this week, maybe right now, right? Because the whole definition of anxiety is worry about the future, right? And so, of course, it makes sense, but we have to be a little bit more calm to actually get it through our minds and then our body to listen. Is no. Let's tighten up this timeline, right? What can you do about it today? What can you do about it now? And if part of the answer is, well, nothing really, but I'm worried about it, then that's where it turns into, one of the phrases that we say is, you have to categorize things. Is it a worry now, worry later, or worry never? And if it's a worry later, that's still important, right? But it's like, well, that's a worry later. Like, what do you need to focus on now? So my immediate response to that would be, yeah, those are stumbling blocks for all of us when we worry about 6 months, 1 year. I just did poorly in that test, which means that, I'm going to get a bad grade for the whole year, which means I'm not going to get into college, which means I'm not going to get a good job, and I'm probably not going to get a partner in life. And you're like, whoa, like slow that down. It was one test. Let's figure out what to do. But that's what we all do. We forecast it so far into the future that it can kind of paralyze us.
Do you have any thoughts on coping with trauma or flashbacks? And I imagine students might experience this in all three of those categories that we've been talking about. We might experience in our body, in our thoughts, and in our emotions. But do you have any recommendations on how to cope with trauma or flashbacks?
Sure. And that's a really big question. It's an important question. The one thing I would say, and even though some people might think this isn't helpful, at least it lets us know what's okay, what's kind of normal, and when does it turn to be less normal and more problematic. Um, if I'm talking to somebody and let's just say, and you know, there was a very traumatic event just within the past week. And if someone's saying, I'm having trouble sleeping, I'm having flashbacks, I'm having all, and if it's within the first week, couple weeks or month, you know, I'm going to help them figure out how to manage that, how to stay as calm as they can. But it's not going to be my goal to try to take that away, because that it's just a normal response, right? If something happens and if we're a couple weeks into it, or maybe a month or a month and a half, we have to try to be as calm as we can, deal with them as much as we can, try to get some sleep, try to figure out things that can kind of calm you down, try to talk to other people about it. Because when we've experienced a trauma, when we have a lot of that going on, one of the biggest risks we have is holding it in. If you have a flashback, if you're angry, if you're sad, if you have fears, and if you hold it in, hold it in, hold it in, not good, right? One example I'll say is if you think about, and this is just in, if people pass away, if you've had a grandparent, if you have, during COVID, we've not been able to have funerals. Well, if you think about it, you know, funerals are important for a lot of different reasons. And one of them is within the first couple of days and within the first week, we all get to join, and we get to join and see each other and talk and grieve together, cry together, maybe even laugh together, be angry together. We get to do all that. So it doesn't stay in, and we're not silent about it. We're joining, and we're just, you know, we are supported in that really intense grief. That's why that's one of the worst things about COVID, in that we're not able to connect in that way. So that's, even though that's a problem, we still have to remember that that's part of the answer. What is the way that even if I don't feel like I can physically be in the same room with some people that would really understand, or I could cry with, yell with, hug, and really try to support, that is still part of the answer, because that's what we all need. So that those are the two parts of my question, is that the bad news is I'm not going to say, you know, I know it's been 2 weeks, but we're really going to make them go away. No, part of it is just, that's your mind, that's your heart, that's your body trying to figure out, what the heck do I do with this? If you're sitting there like 3 months out, 4 months out, and I'm not saying that grief ends, I'm just saying that flashbacks are still there, you're still having a really difficult time sleeping, at about the 2, 3, or 4 month mark, that's when you say, no, like I need to try to just keep doing a little bit better, and maybe I should talk to someone about that.
We had a question, is it bad to keep things bottled up? And I feel like you actually just answered that we definitely don't recommend students keep stress or distress or sadness bottled up.
Yeah.
Yeah. We have a question about maybe if somebody's struggling with their identity, whether that's gender identity or any other part of our identity, do you have any suggestions on good coping skills for maybe dysphoria related to identity or breakdowns, and maybe we don't have the support in our life that we feel like we need in order to work through that?
You got it. That is a great question. And you know, one of the things that I love about working with a little bit middle schoolers, but high schoolers and even college age folks, is it's the first time, like we never stop thinking about our identity, whether it be gender, whether it be sexual, whether it be, we never really stop thinking about that. But you know, these years are the ones where it really comes to the forefront, and we're trying to really figure it out. And we want to try on a bunch of different styles as far as what we're thinking or feeling. So this might sound weird, but the first thing that I talk to folks about when you want to try on a different identity, whatever that is what are your behaviors around that? Are you in a place where you can actually figure out more about that? Like what it would look like, you know, what does it mean to my friends, to my social circle, to any of my supports, to my behaviors, right? Because it may sound funny to think about, but our identity really is tied to our behaviors. So if you're having some of those thoughts and you want to explore some of them, part of them is there a safe way? Is there a smart and safe way for me to either learn more about it, get myself in an environment where I can try to see what that would look like and see if that's a fit for me or not? I think it plays into, just like you said, Mrs. Smith, if I have these thoughts or some of these emotions, we don't bottle them up. Well, that's easier said than done, right? When I talk to folks about, you know, what are their emotions and how do you express it, that means communicating to others. Maybe I do write in a journal. But it's really important you find some either empathetic people, or either people that understand what you're thinking about and what you're considering, so that you can kind of feel that support and you cannot feel so alone, right? If we're trying to do that, like, you don't hear somebody who's like, I'm a great musician, it's part of my identity, but I don't know any other musicians, so I really feel alone. Like, that would be bad. So if you have someone who's struggling with any kind of gender identity, sexual identity, part of the piece is, well, how can I connect either with people that are like-minded to me, or people that will empathize and still care for me with that? If you have that, then you can talk about it and it won't stay as bottled up. So that's one of the best things that you can do about it.
Thank you. So I think some of us have probably experienced this, where we're in a really happy moment, but we're worried that that moment isn't going to last forever. So then we start to feel sad that this moment is ending, or this happiness is ending. So do you have any advice on how to handle that when you're feeling super happy, but then you're also worried that you might not feel this happy again, if that makes sense? Maybe kind of staying in the present.
Yeah. One of the things that I would say, and if all of us need to find whatever kind of phrase or whatever kind of approach will help us, like, really enjoy those happier times, and let us remember them, so we don't get too far down whenever we kind of come down from that kind of happy spot. It's kind of like the analogy people say, it's not about being happy, because happiness, you can never like just get happy and stay there, right? It's just impossible. One of the best things that we can do for ourselves is try to relax and give ourselves enough grace to know that it's going to be like surfing the waves. There's going to be some ups and downs. And if you have people to talk to about that, and if you know that just because I was really happy and now I'm less happy, or now I'm sad, that's okay, because it's kind of about just knowing that I was happy, I'm not as happy now. And then if part of your response is, see, I'm not happy now I'm not sure if I'm going to be happy, that's tough. If part of the response to that same situation is, I'm not feeling as happy, I'm pretty down, but I know that the happiness or the contentment is going to come back, and you're willing to kind of surf those waves a little bit, that's a very different thought, or it's a very different response, or a very different approach to those kind of ups and downs. So yeah, I mean, part of the answer, as kind of happy as this sounds, is, our goal shouldn't be just happiness and staying happy every single moment. It's learning how to be flexible in those waves.
Great, thank you. I think we're going to hit maybe 3 more questions before our time is up. We've got a few students who are maybe struggling to sleep because of PTSD, distress, stress, just overthinking in general. Do you have any advice for those students, or thoughts on how to help those students who are struggling to sleep because of some of the distress in their life?
Sure. Sleep, I'm glad that was brought up, because sleep is something that, it's a fundamental piece. I mean, if I, as a psychologist, don't ask people about sleep, a lot of my clients actually think I focus too much and too soon about sleep. But if I leave that in the background, and if we don't work on sleep pretty darn quickly, then their moods and their thought and their functioning is not going to improve nearly as quickly. But it's easier said than done. So the one thing I would say is, as a resource out there, there's a gentleman called Matthew Walker, and his website is called The Sleep Diplomat. And the reason I give that website is because, I mean, he's got a book. It's a great book, but it's 200 pages. And there's even a version of it, which is just a summary version. It's good. But here's a gentleman who, I mean, he's been on like 20 podcasts, and these podcasts go from like 20 minutes to 2 hours. And he's got TED Talks, and he's got everything else. The more we learn about sleep, not only how important it is, but some of the really basic things, we call it sleep hygiene, then we can kind of commit to it. I was hoping, and I hope it's the case for a lot of folks that have returned to school, or even done a better job on the virtual stuff. Like, one of the most important things you can do is a consistent wake time. Everyone says, I need to go to bed at the same time, I need to fall asleep. It's actually kind of the second or third. Like, if we have a consistent wake time, and if that anchors us, then we will eventually kind of go to bed around the same time, get better sleep. We're going to have to be good about trying to go to bed earlier and earlier, and not distracting ourselves with another Netflix binge or other stuff like that. But certain things, like doing a really good job with a consistent wake time. And here's the bad news for high school students. It also means that you got to try to stick to it as much as possible over the weekend. because if you don't, then it's Tuesday or Wednesday before you're back into any kind of sleep routine. So you might get 1 or 2 decent nights of sleep before the weekend comes again and things get all wonky. So some of those consistencies. And of course, high school students need more sleep than people that are, 30, 40. So it is really important, especially, our high schools at Freeman, they have so many more tasks and so many more challenges than we did when I was in high school. Just what's asked of them academically, socially, and then whatever kind of things that they do on the side, sports, music, everything. So they really do need the sleep. So that would be my first response.
Great. Thank you, Dr. Bitsko. I think we have time for one more question, and it's a good one to close on. How can we help our friends who are struggling with mental health? How are some ways, we're social creatures as teenagers, how can we help our friends?
And I've talked a lot with my colleagues here. I think that starts, whether it's friend to friend or within a family, trying to have some brief conversations about how are you doing, right? It's a very generic question and to check in, but at least it's like, how's your day? Like just finding out a way with your friends, whatever language that is, the folks that you feel close enough to know that we can have just a brief conversation. And I do say brief because that's sometimes, if people know, whether it's parent to their kid or friend to friend, sometimes you want to talk for 20, 30 minutes, an hour, 2 hours, and that's great. But if we can check in with each other just to, especially friend to friend during high school, that is such a critical support. And if they're seeing something, and if they can just try to ask in whatever language works best for that friend group, and just be like, dude, we don't need to talk about this for more than like 2 minutes. That can be really powerful, really supportive in a way that it's a lot better than their psychologist, their parent, even the school counselor, right? That's very valuable.
Great. Thank you so much, Dr. Bitsko. This was very helpful. I hope our students got some value out of it. I know they did. So we are just so appreciative of your time here this morning. And to our students, just remember your school counselors are here for you, your administrators, your teachers. We can definitely be those supportive people in your life. And if you feel like we need some extra help outside of school, we are more than happy to help connect you to professionals in the community similar to Dr. Bitsko. So we appreciate you guys all being here this morning for Wellness Wednesday. Enjoy the rest of your day. We have 2 more school days till spring break. We're so close.